With ABC, Advanced Biostructural Correction, I don't spend any time fixing what your body can fix for itself. I simply focus on fixing the basic problems that your body cannot self-correct. In essence, where a spinal bone needs to be moved backwards. In doing this, it is much like the proverbial peeling of an onion. I cannot start the first time your body was confronted with a spinal bone moving forward and not being able to pull it back, because it's buried under who knows how many other such traumas and multiple compensations. The procedure is simple. I simply find the spinal bones that have been pushed forward and which can be corrected that day and put them back into place. I work up and down your spine, adjusting your body as it changes during the treatment session itself, until the action is complete, at which time you will feel calmer and have no attention on your body, stand more upright, and breathe very deeply. It has rebalanced itself for now with a reduction in the total tension that it has accumulated over your lifetime. Tension accumulates like an onion layer. So as we take the layers off, the tension decreases on your structure. We typically schedule 2 appointments a week, where possible, at least 2 days apart, so as to allow the unwinding process to run its course. Some cases more often, some less. I have a very accurate way of determining how many times a week is optimal. Now, unwinding is a central concept in ABC, so let me explain it. Unwind means to reverse the effects of being wound up, to relax after a period of tension. When I release the stuck points and fix the bones that were pushed forward, which the body was unable to realign backwards into the proper posture, your body leans into a backward position when we first begin, which takes the pressure off of the injured sites. Your body then realizes that the changes it had made to try and deal with that bone being out of place are no longer needed. And in doing so, the body releases the compensations it has created to maintain balance. This leaning back phase during the program is often associated with stiffness falling away and pain subsiding. As the body untwists into a forward position, it uncovers the next earlier trauma involving a bone that it cannot self-adjust, allowing the ABC practitioner to then release it at the next session. Your body will need to untwist forward as well as backward in order to address and release the accumulated tension from the structure. Keep this in mind as I say the following. Please recognize that during the forward unwinding between treatments, any soreness is a good sign, because the body is now able to prepare for the next set of bone and meninges, the sleeve that surrounds your brain and spinal cord, for the practitioner to move into place and release. It's all part of the healing process. The seriousness of the original injury will determine whether the unwinding symptoms will be mild or more noticeable as you go through the unwinding. This unwinding process literally means unwinding your spine much in the same way that a tightly wound rubber band unwinds in 2 dimensions. However, this is in 3 dimensions. You may have noticed that when you wind up a rubber band, it twists and twists until it can twist no more. Then, extra loops occur, and deviations from a straight line of twists start to appear, which generally is where your main chronic pain will be felt, at that loop. This is very similar to what occurs with your spine over time as you experience injuries quickly from impacts or slowly from poor posture, as I will cover in a later video. Unfortunately, this means that your body will take up more and more contorted positions in the ongoing need to keep itself balanced. Unwinding sometimes results in some minor or brief pressures or pains that tend to go away in anything that from seconds to a day or two. If these continue too long or are too uncomfortable, you can come in for a free and simple adjustment to help move along and speed up the unwinding process between your program treatments. It is interesting that as patients unwind from the latest injuries to the earliest injuries, they may sometimes perceive a reminder of an old injury, such as that old knee injury, and they can thereby plot where they are in time in their overall unwinding process. Why is this at a physical level? They were not able to unwind immediately following an injury, so their body formed compensations from the injury, meaning it would wind itself up and prevent the inflammation from fully leaving the knee, let's say. Even though it may take quite a few months, even a year or two, to sort out your body fully, depending on how many traumatic incidents you have stacked up with your body, relief such as standing taller, breathing easier, or pain greatly diminished or gone is noticeable from the very first treatment. You don't have to wonder long. The gains keep building, not backsliding, because with each session, more bones and more meninges are freed from old, forced, incorrect positions and patterns. The general process is an unwinding and a freeing up process. As this process continues, you will feel more and more freedom to move your body with less pain, and physical abilities will return as your body heals. I have often had to ask my patients to change their goals because they have already met the goals they set when they came in originally. And a new, not previously thought possible goal is now set. And so you and your ABC practitioner work together as a team until you have undone the effects of all the earlier injuries and have a spine in perfect balance. No pains, no strains, no pressures, no worries. How can we make such a claim? ABC not only dissolves the symptoms of old injuries, such as tension and pain, but also reverses the old injuries themselves. Once spinal realignment and reshaping are complete, your spine, which normally has natural curves that give it a great deal of strength and stability, will be much more stable, meaning able to endure a greater physical stress before a misalignment even occurs again. Living an active life, of course, one is likely to experience various impacts that may require tune-up treatments with the ABC practitioner. But it would take a greater amount of force than in the past to misalign the patient again. A new misalignment can be created also by poor posture. So we count on you to maintain proper posture when lying down, sitting, and standing. You will occasionally want tune-up treatments to keep your spine stable and relatively injury-proof from the normal, regular physical stresses of life. And obviously, if spinal degeneration or disease are somewhat advanced, you may want to have more frequent tune-ups to maintain comfort and stability. The basic message from ABC to you is that it actually works if you stick with the program. Yes, it may be occasionally uncomfortable, but anyone training for any sport knows what to do with discomfort and pain. Keep going. The rewards will be there. The ultimate message is that the days of seeking repeated adjustments for relief from pain, the same thing being done in a cookie-cutter approach, are over. The days of engaging in activities that you thought were no longer possible lie ahead of you again. Now that we have covered the theory, it is time to see ABC in action, a typical treatment session done on a patient.